Assalamu alaikum dear doctors. In this video I am discussing from the NICE guideline Henoch schonlein purpora. We know that Henoch schonlein purpora come both in video stations and history. So what is the definition of HSP? That is a vasculitic condition of unknown etiology and typical age group is 2 to 8 years. The symptoms and sign. There is rash present. The rash is purpuric raised on the extensor surfaces of the legs, buttocks and arms with surrounding erythema. Gastrointestinal tract, the presentation is abdominal pain, mostly non-specific, typically resolve in 72 hours. It is severe or persistent, exclude intussusception, testicular torsion or pancreatitis, that is rare. Nausea and vomiting, intestinal hemorrhage, hematemesis, melena, bloody stools is rare. Now joints also presented. Joints, there is arthralgia and swelling of the large joints, especially the ankles and knees. Pain typically resolve in 24 to 48 hours. Renal involvement, there is microscopic hematuria, common. Proteinuria can present 4 to 6 weeks after the initial presentations. Hypertension, nephritic syndrome, that is hematuria with more than or equal one of the following. Raised urea and creatinine, hypertension, oliguria, nephrotic syndrome, proteinuria plus minus edema and hypoalbuminemia. There is edema of the hands, feet, sacrum and scrotum. Neurological features are headache, that is common, seizure, paresis, rare. Differential diagnosis of Henoch schonlein purpora. What are the DD? That is purpuric rash, meningococcemia, that is clinical diagnosis, thrombocytopenia, full blood count, rash looks different than ITP, not vasculitis. Rare vasculitis, that is more difficult to exclude, differentiation require review over a period of time, and pancreatitis, suspect if abdominal pain. Now, what are the investigation we do in Henoch schonlein purpora? These are all patients we do blood pressure, urine dipstick, if proteinuria, send urine for early morning protein creatinine ratio. If hematuria, send urine for microscopy. Additional investigation we do blood test if urinalysis abnormal or diagnosis uncertain. These are full blood count plus film, urea and electrolyte, albumin, if fever, blood culture and ASO titer, coagulations, throat swab. Immediate treatment or subsequent treatment of Henoch schonlein purpora. The indications for admission of Henoch schonlein purpora patient is that orchitis, moderate or severe abdominal pain, arthritis involving more than 2 joints and proteinuria. And clear evidence of gastrointestinal bleeding, inability to ambulate. Joint pain. For joint pain, we give the NSAID, ibuprofen first line, use with caution if renal involvement or patient asthmatic. Abdominal pain, we give prednisolone 1 mg per kg per day, maximum 60 mg per kg for 2 weeks. Renal involvement not a contraindications. If severe and paresis, exclude pancreatitis, intussusception or spontaneous bowel perforation. Monitoring. How can I follow up or monitoring the Henoch schonlein purpora? That is uncomplicated Henoch schonlein purpora. Uncomplicated Henoch schonlein purpora, example urinalysis less than or equal 1 plus blood and protein and normal blood pressures. No hospital follow-up required, but GP follow-up in 1 to 2 weeks, monthly blood pressure for 6 months and weekly urine dipsticks at home until urine is clear. Henoch schonlein purpora with hematuria or proteinuria more than equal 1 plus and normal renal functions. As above, plus routine follow-up in children's outpatients. Now, when Henoch schonlein purpora patient, we refer to the nephrologist if number 1, urinalysis blood or early morning protein is more than 1 plus after 6 months, macroscopic hematuria or heavy proteinuria at presentations, hypertension, significant proteinuria, early morning urine protein creatinine ratio more than 100 gram per millimole or 3 plus proteinuria for 3 days, impaired renal function. Refer to rheumatologist if the atypical or rapidly evolving rash. Discharge and follow-up of Henoch schonlein purpora patients. Inform the parent condition may fluctuate for several months, but recurrence rare once settled properly. Very rare risk of renal failure, hence importance of monitoring urine. Seek medical advice if child develops headaches, pararectal bleeding or severe abdominal pain. Uncomplicated Henoch schonlein purpora, GP follow-up as above. Discharge from the GP follow-up if urine analysis and blood pressure normal 6 months after onset. So this is all about Henoch schonlein purpora NICE guideline. Thank you.